Start the recording. All right, hello everybody. Thank you for coming for our first webinar lecture. Today, I'm Dr. Paredes. Today we are going to talk about cell membrane and its physiology. To talk about cell membrane, and please, if you have some questions, just you can interrupt me and we can go from there. Okay, so first of all, let's talk about general things about cell physiology. You already know that the cell are being composed by main components. Number one is the lipids. We have the lipids. Those lipids are, sorry, there is a noise there. What is this? Somebody is doing, I'm going to cut the audio. Okay. So we have the lipids, and the lipids are, as you can tell, amphipathics. Amphipathics means that they are going to, excuse me, I need to cut that noise. Just a moment. Where is this? No, it's not Gina. Hello?
Yes.
Can you hear
Yeah,
me?
hi. I was muted and then it came back on.
Okay, I think it's Michael who's doing some here. I can hear, so I was cutting. Oh, anyhow, so all right, let's continue. Okay, so we was talking about the lipids. The lipids are amphipathic, so that means that they have two sides. One that is hydrophilic and the other one is hydrophobic. We are going to see what is the importance about uh, the bilayer lipid bilayers in a few moments. Another component, we have the proteins. These proteins are actually being used for are going to be used as transporters for substance that cannot pass the double layer, the lipid double layer. And these proteins are not going to be only used as a transporters, but they can be used too as receptors. We have cholesterol here in this area, and this cholesterol, believe it or not, is giving some consistency to the structure of the frame of the membrane cell. And that is this cholesterol deposits here are going to be preventing the cell to distend, the membrane cell to distend. So it's going to help to keep the shape of the cell membrane. We have carbohydrates, and these carbohydrates we have here in this point here. Those are associated sometimes with proteins. That's what we call the glycoproteins. These glycoproteins, sometimes they are going to form, especially in the intestine, what we call the glycocalyx. So anyhow, so the other name of the cell membrane is we will call the plasmatic membrane or plasma membrane. All right. So now, how the membrane is going to contribute to the cell homeostasis. So homeostasis. So it's an internal balance, right? This homeostasis is, first of all, the cell membrane is going to maintain all the inclusions, all the organelles in the internally into the cell. Second, we have the phospholipid bilayer that is going to act as actually as a barrier, and this barrier is to isolate the cell from some changes that can happen in the outside of the cell. They're going to give suspension too for these proteins, and these proteins are totally not static. They're moving. They're up and down, right and left, so any place they want. And this is going to be critical for maintain the membrane cell healthy. And we want that because that is cell function, that is going to be providing cell function, appropriate cell function, growth, and for optimal activity of transport and signs that are coming from the receptors. All right, so what are going to be, and we are going to focus today in the transportation, cell transportation, cell transport. So we have here the what are the functions of the membrane proteins. First of all, they are going to transport. Then they are going to be acting as a receptors. So as we mentioned, these will be working as a receptors or as a transporter for another substance. The general idea is to talk about cell mem transportation we are going to divide it in two areas, passive and active. The passive is something that we are familiar already, is the simple diffusion. We start to think about what are examples of simple diffusion, what are examples of facilitate diffusion, and what is examples of osmosis. So here we have, for example, the cell membrane, and here some molecules of oxygen. So these mostly are going to pass for simple diffusion. If you can tell, we have a protein here that is going to help as a transporter, and in between here we have the lipid bilayer membrane. So the oxygen are so small molecules that they don't need these transports through proteins. They're going to pass directly through the membrane. Same here we have in the next slide, we have here water, this molecule of water. They are going to have some transporters that we call the aquaporine that are going to transport the water from one side to another side. All right, so we will talk about transportation across the cell membrane, and what is the purpose of to know about transportation in this class is to ensure that substances are delivered into the cells. How the cells are going to receive these all these elements like nutrients and gas exchange, for example. So we have here the simple diffusion. According to the chart, we are going to start with simple diffusion. Passive diffusion is without expending energy, as we already know. And one of these components of passive diffusion is the simple diffusion. So at this moment, we are not going to need any carrier that are going to use for transportation. Examples of simple diffusion. Example of simple diffusion, for example, we have when you have a perfume, the perfume is going to diffuse from areas that are high concentrated to low concentration. The smoke of the smoking, for example, if you smoke in the corner of the class, you're going to the smoke is going to start disperse all over the rest of the room. So we have, for example, the tea bag. A tea bag, when you use tea, you infuse tea, the tea is going to diffuse for simple diffusion. We have, for example, a very good example of just to put some coloring on the water, and the water start to take the color, and that is example of simple diffusion too. In the body, the main example that we can tell is the gas exchange. Gas exchange of especially carbon dioxide. We have the oxygen, and another areas of the body are going to do nitric oxide, that is a potent vasodilator of the vessels. All right, so another things that can be transported by simple diffusion, we will have the steroids like, for example, aldosterone, like cortisol, like sexual hormones, and the fatty acids. So mostly they are going to be passing through simple diffusion. All right, so the simple diffusion has a main thing, that is that the substance are going to move from high to low concentration. So you know that in the universe, everything is it's going to be getting a balance. So equal concentrations on one side to another side. So that's why how particles can travel from high concentration areas to low concentration areas, like the smoking, like the smell of the perfume, etc. Okay, so let's start talking about how is the flow or the flux of diffusion. So for this, just remember that we have some terms that we need to remember. We have, first of all, the permeability. What is permeability? Permeability describes the easy with which a solid diffuses through a membrane. And why do we know we need about permeability? Please, I don't want to lose that perspective. We are talking about simple diffusion. And how is the flow of this simple diffusion is what we are going to talk right now. So permeability is important. It's like we have a house and we don't allow everybody to come into the house, right? So we permit to come some family or some friends, but no strangers, for example, right? And the permeability has that function. In order to maintain actually the balance of water, so the permeability is going to allow the cells to exchange, for example, amount of fluid. And they're going to, for example, have the ability to bring glucose, amino acids, and inside the cell. They are going to control the amount and kind of substance, and for example, they are going to get away from the waste products, like for example, urea. Urea can actually be permeable to the cells and definitely to be excreted. So that is one component of the flow of the diffusion, permeability. Obviously, we have an area. So the more area that we have, the more flow will we find. The more concentration, the more difference of concentration. If you have a big difference of concentration, most likely this diffusion is going to happen strongly. So in conclusion, we have here the J. J is the flux of flow, and that is directly proportional to permeability and the area of exchange and that concentration. So that means that the more diffusion we will find, the more diffusion is when we have more permeability or more area of absorption or more differential of concentration between substances. So those three components are going to lead for the flow of the diffusion. All right, so here we have one example of how to calculate diffusion, and definitely, particularly, I'm not really want to go over exactly how to calculate this, but the concept is what is we follow. Here we have the urea concentration in blood is 10 milligrams per every deciliter or every 100 mLs. And the urea concentration of the proximal convolute tubule is going to be 20 milligrams for every 100 mLs. So you can tell here in the blood, in this case, the urea is less concentrated and more in the blood and more concentrated in the urine, in the convolute tubule. If the permeability of the urea is this, and the surface of area is going to be 100 centimeters square, what is the magnitude and direction of the urea flux? So if we do the calculations, so we are going to use our formula, permeability, area, and that multiplied by the differential of concentrations. At the end, we are going to have this flow that will be about 0.001 milligrams per second. And what is the direction of the urea? So many people think that the urea is just being excreted, but it's actually not totally true. First of all, because of the urea is high concentration in the urine and lower concentration in blood, as we already said, the direction of the flow is going to go from high concentration to low concentration. And in this case, from the proximal convolute tubule, they are going to flow towards the blood. So the urea is absorbed we produce about 50 grams, that is the half of the weight of the bread, and that is 50% of this, in addition, is reabsorbed by the body. And this reabsorption is useful. Why? Because they are going to be concentrated, especially in the medulla of the kidney, where we have a gradient of concentration to allow the water come into the convolute tubules again. So once the urea is reabsorbed, the urea is going to bring water with him, and that is a way to retain water. All right, so that is an example of what is about simple diffusion. We just need to remember that we have these three components: the permeability, the differential concentration, and the area of absorption. All right, so here we have permeability, and the permeability, as we already mentioned, is described as easy, which the solid diffuse through a membrane. We have factors, for example, the lipid solubility, size of the solute, and membrane thickness. So pay attention of these factors because could be equations for the post-discussion. Lipid solubility. So we have lipid solubility. We have, for example, the liposoluble vitamins. The liposoluble vitamins are going to be the A, D, E, and K. And these, because of this lipid component, they are going to be easier to pass or to be permeable through the membrane, at the difference of the water-soluble vitamins that are the B and the vitamin C. They are not going to be easier to absorb by the cells because they are not liposoluble, they are water-soluble. The size of the solute, the smaller the solute, the easier and the fastest it to permeate. So for example, we have sodium and potassium. So sodium is smaller than potassium. If you remember the periodic table, potassium is a little bit lower with more number of neutrons and protons. Anyhow, so we have another factor that is going to affect the permeability is the membrane thickness. The thinner the membrane, the greater the permeability. Okay, so we have some solutes that are going to be easier to pass than others. Hydrophobic solutes are more permeable in the lipid membrane because they are away from the water, but they are trapped by the fat. So you can tell the fat and fat they can mix, but water and fat don't. We have, in contrast, the hydrophilic. The hydrophilic solutes are actually rely on water-filled channels or pores. So all these, for example, the vitamin B, vitamin C, they are going to pass through channels. They are not going to pass through the lipid membrane because they are going to reject it. All right, if a solute is an ion, then we see that the flux diffusion depends on the concentration of what we call the concentration gradient. The concentration gradient. All right, so here we enter into the facilitate diffusion, and once again, the best example of facilitate diffusion is the glucose. Glucose enters into the cells through facilitate diffusion. Not only glucose, but it can be, for example, sodium, potassium, chloride ions, and they are, and the ones who are not able to pass through the membrane are going to use facilitate diffusion. And this facilitate diffusion, according to the picture here, is a double protein that are going to make a gate for the entry of this substance that we just mentioned. All right, so this mode of diffusion is more rapid than the simple diffusion. This is going to take about 1/10,000 of a second, 1,000th of a second in order to complete the transport. All right, so another example is that this transporter, we have glucose, and in this case we have example of galactose. This galactose can compete with the sites of binding of the glucose. So they can be as work as a competitive inhibitor. All right, so here just to show you, here are these proteins. These proteins, they have a specific, they are specific and they are selective. So, for example, in this case, you can see potassium and sodium. If you see potassium is a bigger molecule than sodium. So these receptors, you have here these quaternary proteins that are located in the membrane of the cell, are going to create like an opening in the middle. This opening is going to exactly match with the size of the element that are going to pass through. In this case, potassium. So with this, we can infer that there is different receptors or different transporters for potassium and sodium. So they are different. They are not going to be exactly the same. Just remember, these are proteins. There are 1, 2, 3, 4 proteins coming together and actually create a gate that are making that are going to allow the sodium and potassium pass. Okay, so let's keep going with the cell membrane transport. We have and tell me one thing, osmosis we are going to see in a few moments. So let's start with active transport. Active transport, at the difference of the passive transport, is going to consume energy. So basically, they are going to use ATP. This ATP is going to give a phosphorus or phosphate into the transport protein, and that is called the phosphorylation. When that phosphorylation happens, when ATP give one phosphorus to the protein, they are going to be called phosphorylation, and that is going to allow the opening and close of the activity of the facilitate diffusion. So one of the we have types of active transportation, primary and secondary transportation. Let's start with the primary, and we will see what is the difference with the secondary transportation. Primary transportation, or primary active transportation. So the solutes move against the electrochemical gradient, so it's going to move against the concentration gradient. So we have the primary example, we have the sodium potassium ATPase pump, or the sodium potassium pump. We have the calcium pump, and we have the hydrogen potassium pump or proton pump. Mostly the most common and the most spread out pump in all the body, and probably the most important, is the sodium potassium pump. What is doing the sodium potassium pump at the end? So what they are trying to do is to keep the electrical chemical gradient, and that is going to help to maintain the resting potential. So the resting potential means that the cells is without any activity, so there is no electrolytes or minerals coming in or out. So that is what is doing the sodium potassium ATPase. So we are going to see some examples. We have calcium pump. The calcium pump is going to be mostly in the muscle. In this chart, we are going to see what is doing the calcium pump. Here we have the membrane of the muscle. Here we have what we call the T-tubules. The T-tubules are going to produce some depolarization with the sodium when they enter into the membrane. And that here we have the sarcoplasmatic reticulum. What is the sarcoplasmatic reticulum? It's actually an endothelial reticulum. In the endothelial reticulum, in the muscle, we call the sarcoplasmatic reticulum. So what we have here is high concentration of calcium inside the sarcoplasmatic reticulum. So that is going to waiting until the muscle contraction is going to happen. So here's the cytoplasm, and here we are going to see the myosin and the actin. And the myosin and actin, they need to have calcium in order to to make that contraction. So that is, in this case, what we have is the calcium pump. And the calcium pump, what it's doing, where it's located here in this membrane, in that sarcoplasmatic membrane. And that is going to produce the entry of calcium into the sarcoplasma and waiting for the next order for contraction. So these transporters are going to push actually inside calcium against the gradient in order to wait until the next depolarization of the cell of the muscle cell happen and the contraction occur. All right, so here we have here some okay. Here we have the sodium potassium.
I'm sorry, Dr. Paredes. Before you go on, I have a question. The T tubule, is that an extension of the cell membrane wall?
Yes, that's correct. So the sarcoplasm or sarcoplasm is going to be a continuation. It's going to be actually an invagination of the membrane of the muscle. That is going to conduct the depolarization of sodium when the neuromuscular muscular junction is going to be activated. Okay, so here we have the extracellular space and we have the intracellular space. As you can see here, we have a transporter, and this transporter, we have actually what we call the sodium-potassium pump. So in order just to see, we have only one, but the exchange is going to be 3 sodiums and 2 potassiums. In this case, we have this pump is going to work against the gradient of concentration. You can tell here that there is more sodium in the extracellular, and what is doing this pump is to contribute to increase this electrical potential or membrane potential. That is the difference of charges between the extra and the intracellular membrane. So that is how it's going to work. Here we have, for example, this is going to consume energy, and this sodium is getting into the binding site. Then is going to come the ATP. The ATP is going to give phosphorus, that is the phosphorylation. This phosphorylation produces the changes of the shape of the protein, releasing the three sodiums and allowing potassium to go to the binding site. When that happens, you can see the phosphorus goes out, and that is going to be in the rest stage again. So that is how the sodium potassium is working. Okay, so we already talked about the potassium ATPase pump that is in the sarcoplasmatic reticulum. We have the potassium hydrogen pump that is mostly working by the parietal cells, the one who produce gastric acid, that is going to transport hydrogen into the lumen. All right, so if you can see, for example, the hydrogen potassium ATPase can be inhibited by some for pump inhibitors, proton pump inhibitors, the PPI. So those are, for example, the Prilosec. Okay, so those are for medications that are going to block and actually decrease the acidity in the stomach. In calcium pump, we are going to see that are going to play a role on some pathologies. For example, you know, you need calcium in order to make the contraction of the muscle. If you inhibit this presence of calcium into the cytoplasm, that is, if you increase the calcium in the cytoplasm, that is going to improve the contraction. Example, for example, the lanoxin or digoxin, that are going to stimulate the contraction of the cardiac muscle. All right, so here we have the secondary active transport. And what it's doing here, basically, first of all, we have two things. We have the sodium glucose co-transport and the sodium calcium counter transport. What is common in here is that they are going to use sodium in order to actually make the exchange. So I will go over here in this. I'm sorry, there is some tigers there. All right. So here we are going to see, for example, the co-transport. The co-transport, what is a co-transport? Is they are going to transport together in the same direction the sodium and glucose. So sodium and glucose are going to move from the extracellular to the intracellular membrane. So we are going to see in this co-transport, it's called co-transport because are coming together. Sodium and glucose are going to use the same transporter. So, but it's not actually everything about the co-transport. In this co-transport, we have the source of this to produce this entry of these products are going to be from here. So this is the sodium-potassium pump that is the primary source of energy. So this is going to pump sodium from the intracellular to the extracellular, making even the sodium be in higher concentrations in the extracellular. So that is going to make the sodium get into the come back to the intracellular, but at the same time they are going to be attached to glucose coming together. So that is the co-transport or symport. Symport is going in the same direction. So that is symport is going to go from the extra to the intracellular, and the source of energy is coming here from the sodium-potassium pump. So that is the co-transport, and that is the symport. Okay, so the next one is we're going to talk about the antiport, and we are going to use the same cartoons here. Here, the antiport, we have the is the counter transport, where can you see sodium is getting inside, but calcium is going outside. Sodium is getting inside, and calcium is going outside. So what is coming from the source of energy for this transportation? Again, it's going to be from the sodium potassium pump. Sodium is going to increase even more the membrane potential, the difference of ions between the intra and the extra, and when it is loaded, they are going to enter sodium into the cell, and the calcium is going out. All right, so let me see if I have this something here. So here we have a cell, and we are going to make the application of what we just we was talking. So this is a cell, and here we are going to have potassium, intracellular potassium, that mostly is located intracellular, right? Then we have sodium that is more concentrated in the extracellular. So what happened then? But because of this differential concentration gradient, they are going to go towards the current. So it's going from high concentration to lower concentration. Meantime, we have potassium that is coming from higher concentration from inside the cell to outside the cell. So that is the purpose of this. So we are going to try to keep to the resting potential. The resting potential is the difference between positive and negative charges from outside inside when the cell is in resting state. In this case, to keep this resting potential, we are going to use the sodium potassium pump. So what is doing the sodium potassium pump is going to exchange 3 sodiums and for 2 potassium. So we have 3 sodiums coming out and 2 potassium coming in. So, and that is against the gradient. So that is what we call active transportation. We have another one that is the sodium calcium pump. And the sodium calcium pump is going to use this 1 calcium from the intracellular and 3 sodiums exchange to the from extra to intercellular. So what happened here is calcium go out and sodium come in. So calcium go to the extracellular to keep the resting potential. So this is an example of muscle contraction. So especially of the cardiac muscle. So what happened if we have, for example, digoxin or lanoxin? So what it's doing is, first of all, is to block the sodium-potassium pump. That is what is doing the digoxin. It's going to block the sodium-potassium pump, and doing that, what it's going to do is that the sodium is not coming out of the cell. So the concentration of sodium are going to be increased in the intracellular space. Now, in addition to that, because you have high concentration of sodium in the cell, this pump, sodium calcium pump, the sodium is going to be inhibited to enter into the cell. So what is going to happen is the calcium cannot go out. So what happened? Calcium is going to start accumulating in the cell. So what is doing digoxin? Digoxin, what is going to do is inotropic and chronotropic, as you can tell. Chronotropic means going to increase the rate, and inotropic means increase the contractility of the heart. This is mostly used in cases of heart failure. So that is an example of how these sodium potassiums are going to work. So again, potassiums, sodium in extracellular, more concentration. So we have a potential concentration gradient. Then in order to keep the resting potential, what is the resting potential? We want to have more potassium inside than outside. And the sodium potassium pump is going to help for that. So, all right, so that is going to bring more potassium inside the cell to keep the resting potential. All right, so then we have, in this cardiac muscle, we have, for example, exchange of calcium and sodium, and digoxin that is going to inhibit the sodium potassium, increasing the sodium intracellular. That is going to, we don't need any more sodium high concentration in the cell, so this is going to be inhibited, and calcium starts to build up in the cell, and that is the action of the digoxin. Okay, so let's keep going with osmosis. Everybody knows, everybody have a concept about osmosis, and osmosis is just the process which molecules of a solvent tend to pass through a semi-permeable membrane. So how is transport the water in the cell? Through osmosis. So that is generally in all the 100 trillion cells that we have are going to have this process. The membrane is going to be a semi-permeable membrane. All right, so talking about how to calculate the osmolarity in the body normally is about 280. And what does it mean, osmolarity? Osmolarity means how much of solutes we have in blood. That is actually what is osmolarity. And osmolarity is going to let us into concepts like hypertonic, hypotonic, isotonic. So the osmolarity of the blood should be exactly the same of the osmolarity inside the cell. And when the osmolarity are different outside the cell is where osmosis is going to occur. Osmosis, so you know, the water is going to pass from actually low concentration solutes to higher concentration solutes in order to dilute both sides. So remember at the beginning we was talking about the universal balance. Everything should be equal concentrated in both sides. So that is actually because in osmosis the molecules cannot pass through the membrane because are too big. What is going to happen is going to pass just water. Okay, so here we have the Van Hoff law, and the Van Hoff law, we have here osmotic pressure. What is the osmotic pressure? The osmotic pressure is very simple way to understand that is how much pressure is making the fluid passing from one side to another side. And depends on what? Depends of the difference of concentration of solutes in both sides. If the concentration are very similar, the osmotic pressure means the water that is need to pass through the membrane is not going to be that strong. But if you have big difference of concentration of solutes from one side to another side, that is going to increase the pressure of the water trying to go through the membrane. And that is what we call the osmotic pressure. This osmotic pressure are going to have some formula that is directly proportional to the number of particles in solution. We have the gas and absolute temperature that are constant, and the concentration of the solids. So in reality, we need to pay attention in these two components: number of particles and the concentration of particles. So those are directly proportional to the osmotic pressure. So the more concentration on one side, that is going to lead in more osmotic pressure. The more number of particles in solution, that is going to increase directly the osmotic pressure too. All right, so talking about diffusion potential is the difference generated across a membrane because of a concentration difference of an ion. Can only be generated if the membrane is permeable to this ion. Usually very few ions in difference, and therefore do not result in changes in concentration. So, for example, here we have the voltage gate channels. The voltage channels is a type of facilitate diffusion. So facilitate diffusion is going to be used for the transportation, for example, sodium, potassium, water, and they are going to work based on the membrane potential. Remember, membrane potential is how difference on charges are in the intra versus the extracellular, and they are going to work together with a concentration gradient. So these transporters are going to work together with a membrane potential. So how many charges, positive or negative, we have inside or outside the cell, plus the concentration gradient. So these voltage-gated channels are going to be, for example, for sodium and for potassium. So the activation of gate of sodium channel in the nerve is open by depolarization. So when these channels are going to be open? Especially you need to know that the depolarization of nerve cells, muscle cells, or cardiac muscles, the first step is the entry of sodium. So that is going to be activated gate for sodium channel. So it's the initial of the contraction of the smooth muscle, initial the contraction of the cardiac muscle, or the electric impulse of the nerve. We have another type of transporters that are going to be more specific. We was talking about that they're very selective. Is the ligand gate channels. They're going to be mostly transport neurotransmitters, acetylcholine, etc., and other transmitters. All right, so the diffusion potential are going to have actually that is going to tell us how the cell is going to get into the resting potential. So resting potential means that there is no ions coming in or coming out. So, for example, this Nernst equation is going to talk about the diffusion potential. For example, in the membrane potential is the membrane potential where the net flow through any open channels is 0. So in which moment the cell is going to be into resting potential. And that's what is the Nernst equation is calculated. So this calculation is going to tell, for example, sodium sodium and chloride here. So this is only permeable selective for chloride. So this chloride is going to pass to the other side. So for how long? How much? Until this getting into the resting potential. So that means there is no need anymore for exchange or coming out, coming in of chloride. So so in conclusion, what I want just to let you know about the next equation, that is the is the is the calculation of what is going to be the flow for potassium or sodium when is in resting potential. So we don't need anymore. So how much voltage are going to achieve the membrane of the elements in order to stop the flow of these minerals. All right, so for talking about electrical potential, we need to actually going to review some few concepts, some definitions here. What is electrical potential? Electrical potential is the same to say electrical field, and that is determined by the amount of charges outside and inside the cell. So electrical potential is sometimes confused with electrical flow or current, but is actually the electrical field, is the amount of charges outside and inside the cell. So then after that, we go into the membrane potential. The membrane potential is the difference of charges that are inside and outside the cell. It's the difference of the electrical potential between inside and the outside cell. So basically, we are going to use membrane potential as many times in the next slides. Now, what is actual potential? Action potential. Action potential is the changes in the amount of charges inside the cell. You can see the difference between membrane potential and action potential. Membrane potential is just the difference. We want to know what is the difference between inside and outside with these charges. But action potential are how much are those changes. So how much of this amount of ions are coming in and how many are coming out. The resting potential is, we see, is the difference of charges that are going to be achieved during the rest period of the cell. That is what we call the repolarized cell. Then we have the depolarization. And the depolarization is the actually that is turned into more positive inside the cell. And stimulus change the membrane permeability for sodium. And that is what is happening, for example, with acetylcholine. Acetylcholine is going to produce the depolarization of the cell, producing the opening of the sodium channels, and these sodium channels are going to enter into the cytoplasm, making the inside more positive. So just to remember, depolarization is going to make more positive the inside of the cell. The repolarization is going to be the opposite. The repolarization is changes in the membrane potential that makes more negative the inside of the cell. And we have the hyperpolarization that is making the cell, the inside of the cell, more and more negative. So action potential is important to remember. The action potential is going to lead into the depolarization and then go into the repolarization. Membrane potential is just the difference. There is no action there. So it's a difference between outside and inside the cell. So here we have a graphic where we can represent the depolarization, the repolarization, and the resting potential. You can see here that during the resting stage we have minus 70 millivolts. So that means what is that? This is not actually no negative charge. Is negative means that is what's happening inside the cell. And this 70 millivolt is the difference between the outside and the inside. So here we have the depolarization and we have the repolarization. The depolarization, in this graphic is, we can talk about cardiac muscle, smooth muscle, and the nervous system. So the cardiac muscle, the smooth muscle, and the cardiac muscle and the skeletal muscle are going to produce what we call the depolarization, that is the contraction of the muscle. In the nerve cell is the initiation of the electrical impulse. And the repolarization is the diastole in case of the heart and the relaxation of the muscle. In the nerve is going to be the resting potential of the repolarization of the nerve cell. Just to remember here this, and that is going to help us to memorize or to remember what is happening on this action potential. All this is action potential. If you can see, this is depolarization. This is the initiation of the contraction or the electrical impulse. So what we need is sodium first. Always is coming sodium first. Then after that is coming calcium. This calcium is to complete that depolarization. After the depolarization happens, they are going to enter into the cell and then chloride magnesium. So what does that mean? This is the voltage, and this is inside what is happening inside the cell. Sodium is getting inside the cell, and the amount of sodium inside the cell are going to increase very rapid, very fast. At the top, to complete the depolarization, we need calcium. And this calcium, when they enter, are going to end with what we call the contraction of the muscle. After this is coming on this side is coming the repolarization, where the calcium is going to increase in the cytoplasm and the chloride magnesium too. In other words, when you start the depolarization of a cell, the channels for sodium are going to be open. Then to complete the depolarization, they're going to start opening the channels of calcium. When the repolarization are going to start, the channels of sodium are going to be closed, the channels for calcium are going to be closed, and they are going to open the channels for potassium and chloride. So if you remember this chart, that is going to help us in order to understand very easy how happened the depolarization and repolarization of nerve cells or muscles. Okay, so resting membrane potential. What is resting membrane potential? Resting membrane potential is the difference of charges that are inside or outside in the resting state of the cell. For example, resting state of the cell is going to be the relaxation of the cell, or in the case of the nerve, is in the resting stage. So the cell is not receiving any stimulation, so there is no any action potential. All right, so resting membrane potential. At rest, the nerve membrane is far more permeable to potassium than sodium. And then if you remember here, the resting potential of the nerve is going to be in this area. So the potassium channels are going to be far away, more permeable than the sodium. Why? Because we are in the repolarization phase. Okay, so some another terms that we need to remember is that depolarization is when the membrane potential becomes less negative. So less negative inside, or actually we can say more positive. Inward current is the flow positive charge into the cell. Outward is the opposite. Action potential is the property of excitable cells consisting of rapid depolarization. So action potential is involved the depolarization and the repolarization. All right, so talking about the neuromuscular synapses transmission, here we have the terminal ending of the axon, and here we have the muscle. These muscles are going to connect it with the nervous system through what we call the NMJ. Is the neuromuscular junction. This neuromuscular junction is going to receive the neurotransmitter called the acetylcholine. So what is doing the acetylcholine? The acetylcholine is really relevant because that is going to initiate the depolarization of the in this case of the muscle. But you already know the pathway of that, so you know the acetylcholine is going to make the depolarization. That means the sodium, as you remember in this chart, what is happening first? Always sodium get into the cell in order to have the depolarization. So when the sodium get depolarized, the sarcoplasmatic membrane, that are going to go through the T-tubules. So T-tubules is like a tunnel where the sodium are going to depolarize the membrane. When the T-tubules transport the calcium, the sodium into the cell, the T-tubules transport the calcium, so the sodium is going to depolarize at the same time the sarcoplasmatic membrane, where we have the whole amount of calcium waiting for depolarize. So in that case, calcium go out of the cell, they go into the, out of the sarcoplasmatic membrane, they go into the cytoplasm, and in the cytoplasm, they're going to act with the troponin to release the actin myosin to produce the contraction. All right, so that is something that is we know from normal anatomy physiology, but what I want just to pay attention is in this. We have here the terminal axon, and the terminal axon, what it's doing is to release the acetylcholine. This acetylcholine is going to look for receptors called the nicotinic receptors, and these nicotinic receptors are going to trigger out the entry of sodium for depolarization. Now, what I want to focus here is this, is that the acetylcholine, they go into the synaptic gap. This is a synaptic gap. Always is going to be present. It's a space between the terminal axons and in this case the NMJ. Or it could be, in case of the nerve, or the next nerve dendrite. So in this case, we have the acetylcholine, and the acetylcholine, what it's going to do is we have the acetylcholine are going to produce here, is going to produce, is going to suffer the effect of the acetylcholinesterase. The acetylcholinesterase is going to destroy part of the acetylcholine, so not all acetylcholine is going to pass to the next cell. Some of these acetylcholine are going to be transformed into acetate and choline. Acetate and choline. This acetate and choline, they are going to be recycled in order to get into the terminal axon. Okay, so I think I was trying to cover everything. I think it's my first webinar, so I want you to understand that I was trying to prepare as much as I could. And well, if there is any questions, I will be happy to hear.
I think you did a really good job. That helped a lot.
Well, all right, thank you. And well, I think I can probably try to make it more clear because I'm trying to use in simple words what actually we want to know. So please check the homework assignments. Everything that we was talking here in the lecture is we are going to ask in those questions. So please, if you have any other question, let me know. And thank you for participate. And Joe, are you okay?
Yeah, that was very good. Thank you. I'm fine.
Okay, Joe.
Thank you.
Okay, so I don't know how to close this. Just a moment. All right, so I will see you. If there is any question, just tell me by by email. I will be happy to answer at any time. All right, thank you anyhow, everybody.
Right.
Thank you.
Thank you.